Assalamualaikum and greetings I wish to Dr. Roziana and my fellow friends. My name is Nurjazilah Binti Abdul Rahman. So in this video, my team are going to talk about polycystic ovarian syndrome or Pcos. Now, let me introduce our team member first. And these are the agenda or subtopic that will be covered in this video. Pcos has been reported by two scientists named Irving Feldstein and Michael Laventel in 1935. That is why Pcos also known as Stein-Laventel syndrome. So, what is Pcos? Basically, people believe that Pcos is about cysts, acne, menstrual irregularities, subfertility or infertility, and hirsutism. So, from my understanding, Pcos is a condition where the follicle in the ovaries cannot ovulate, mostly due to the hormonal imbalance. And it has become the most common factor of infertility. From my reading, there are three main features of Pcos, which are anovulation, hyperandrogenism, and polycystic ovaries. If a woman has at least two of these features, this person may be diagnosed with Pcos. Okay, here we can see the differences between normal ovaries and ovaries of Pcos patient. In polycystic ovary syndrome, one or both ovaries can contain multiple small fluid-filled sac immature ovarian follicles that can appear as cysts, and the size of ovaries in Pcos patient is twice than in the normal one. Normally, ovarian follicles contain egg cells, which are released during ovulation. But in Pcos, abnormal hormone level prevent follicles from growing and maturing to release egg cells. Instead, these immature follicles will pile up in the ovaries. Most women with polycystic ovary syndrome produce excess male sex hormones, which is androgens, or we call this condition as hyperandrogenism. Having too much of these hormones typically leads to hirsutism, which means the person will have excessive body hair growth. So statistically, 1 in 10 women have the potentials of getting Pcos, and 50% of them are asymptomatic. However, the prevalence of each region are differ regarding to the different ethnicities across various geographical diversity and social settings. The prevalence of Pcos reportedly ranged from 4 to 20% that affected women within the reproductive age group worldwide. Based on a study by Rui Yang, the data shows the frequency of Pcos was increased from 2010 to 2020 for each age class. From the graph, we can identify the highest prevalence of Pcos is in the age of 20 to 29. This statement is owing to the fact that the changes of lifestyle and diet nowadays.
Next, I will explain about the factors of Pcos. There are three main factors of Pcos to occur, which are insulin resistance, obesity and diet, and lastly, heredity. Actually, there are no exact causes or factors to occur. However, based on some research, the main reason for Pcos to occur is insulin resistance. Based on the article, Should All Women with Pcos Be Treated for Insulin Resistance by John C. Marshall, the statistical insulin resistance and the compensatory hyperinsulinemia affect some 65 to 70% of women worldwide with Pcos. Insulin is a hormone that the pancreas makes. It allows cells to use sugar for our body's primary energy supply. Insulin resistance means that the body cannot use insulin well. If cells become resistant to the action of insulin, then the blood sugar levels can go up. This can cause our body to make more insulin to try to bring down the sugar level. Furthermore, insulin levels build up in the body may cause higher female hormone levels, which is androgen. If the androgen levels are high in female's body, they could have trouble with ovulation, which is the process where eggs are not developed on the regular basis and are not released from the ovary. Therefore, one of the signs of insulin resistance is dark velvety patches of skin on the lower part of neck, armpit, and under the breast. Moreover, the other factors of Pcos to occur in females is because of environmental risk factors, which are obesity and diet. Lack of concern about balanced diet will lead to obesity. Obesity is an independent risk factor of anovulation based on growth stage. ovulation happens when an egg, which is ovum, doesn't release from the ovary during the menstrual cycle. Based on the article Phenotypes and Environmental Factors, their influence in Pcos, obesity not only worsens the metabolic profile but also aggravates ovulatory dysfunction and hyperandrogenism. Why are women with polycystic ovary syndrome obese? By T.M. Barber stated that the majority of women with Pcos, which are 38 until 88%, are either overweight or obese. It is now well established that Pcos represents a complex trait similar to type 2 diabetes and obesity, and that both inherited and environmental factors contribute to the Pcos pathogenesis. Furthermore, research suggests that certain genes might be linked to Pcos. Having a family history of Pcos may play a role in developing the condition. The article The Genetic Basis of Polycystic Ovary Syndrome, a literature review including discussion of PPARY by Ayla Harmansi, stated that familial aggregation of Pcos phenotypes and associated metabolic reproductive abnormalities has been long noted. Other than that, HEC utilized high-resolution ultrasonography to identify polycystic ovaries in 61 women with menstrual disturbance, hyperandrogenism, obesity, and infertility, as well as in their first-degree female relative. They found that 67% of mothers and 87% of the sisters were affected. Moreover, by using NICHD criteria for the diagnosis of Pcos, CASA reported the rates of Pcos in mother and sisters with Pcos is 24% and 32% respectively. Meanwhile, LEGO reported that 22% of reproductive age sisters with Pcos fulfill the diagnosis criteria of Pcos. All of this research clearly shows that heredity is one of the factors of Pcos to occur.
A symptom is a sign of a disease or disorder in the body. How do we know when we have Pcos? According to the Journal of the Endocrine Society regarding the polycystic ovary syndrome Pcos, this hormone problem may show a symptom to a woman, which is firstly reproductive terms, the symptoms of menstrual disorders. In detail, it is about having irregular or absent periods. The menstrual disorders may vary. It happens from complete absence of menstruation to menstruation delayed to 35 days or more to heavy bleeding. Other than that, menstrual disorder, women may have difficulties with fertility. Next, on the physical body, the symptom may be shown as having excess hair growth, acne, and weight gain. Upon that, the polycystic ovary syndrome Pcos can lead to distracting women's mood, which the symptoms shown as they may feel increased anxiety or depression.
According to R. Charlotte Moffat in his article, Emerging Role of GIP and Related Gut Hormones in Fertility and Pcos, there are 6% to 8% of reproductive age women suffer from Pcos, making this disorder one of the most common endocrine abnormalities. Given that Pcos is a syndrome of multi-organ dysfunction such as hypothalamus, pituitary, gonads, adrenal gland, pancreas, liver, and adipose tissue, it is unsurprising that it has strong correlation with type 2 diabetes and metabolism syndrome. According to CDC, women with Pcos are often insulin resistant. Their bodies can make insulin but they can't use it effectively. Type 2 diabetes occurs when the cells of the body become resistant to insulin, which leads to the abnormal amount of insulin being made. Cell does not respond normally to the insulin. The pancreas makes more insulin in order to try to get the cells to respond. Eventually, the pancreas can keep up and thus blood sugar level increase and lead to type 2 diabetes. Elevated cholesterol, high blood pressure, increased insulin level, and glucose intolerance are common to Pcos women, all of which escalate the risk of developing diabetes and heart disease. Women with Pcos are at higher risk of elevated cholesterol, triglyceride level, and low amount of high-density lipoprotein, which is the good cholesterol. An unhealthy amount of cholesterol can lead to atherosclerosis, which is fatty plaque built up in the heart arteries. This condition is highly dangerous to our blood to our heart blood vessels, causing blood clots and abnormal blood flow. It can directly cause heart attacks, heart failure, and also the stroke. A 2019 study published in the European Journal of Endocrinology revealed that women with Pcos are 2 times more likely to develop sleep apnea. Sleep apnea is associated with obesity, diabetes, and heart disease. Sleep apnea is a respiratory disorder in which a person experiences pauses in breathing, which can last from few seconds to few minutes. Dr. Dokras, the director of Pan Polycystic Ovary Syndrome Center, said that women with Pcos will not only experience sleep apnea, but they also can get other Pcos symptoms such as tiredness.
Now I will explain the diagnosis of Pcos. There is no single test to specifically diagnose Pcos. The doctor will ask about the medical history, symptom, and undergo a physical exam to diagnose Pcos. First is transvaginal ultrasound. The doctor will check the appearance of ovaries and the thickness of lining of the uterus. It can show whether the ovaries contain significant numbers of follicles, polycystic ovaries. The ovaries may be 1.5 to 3 times larger than normal when you have a Pcos. Second, Pcos can be diagnosed by doing a blood test where it measures hormone level and screen for diabetes or high cholesterol. For example, FSH might be lower than normal while LH, testosterone, and estrogen may be higher than normal. Third is by doing a pelvic exam. The doctor will examine and feel the vagina, cervix, uterus, fallopian tubes, ovaries, and rectum for any changes. They will check the reproductive organ for masses, growth, or other changes, and check whether the ovaries are swollen or enlarged. Next, I will proceed with the treatment to treat Pcos. Treatment for Pcos depend on several factors such as age, how severe your symptoms, and the overall health. The type of treatment also depends on whether you want to become pregnant in the future or not. If you want to become pregnant, you should have a change in diet and activity. A healthy diet and more physical activity can help you to lose weight and reduce your symptoms. Additionally, they may lower blood sugar level, aid in ovulation, and improve the way your body uses insulin. Based on the article review by Katerina Harwood, minimal weight loss of 2 to 7% of body weight reduce androgen level and improve ovulatory function in many patients with Pcos. Next is, the patient should consume modification to cause ovulation. Medication can help the ovaries to release egg normally. This can increase the chances for a multiple birth. For example, clomiphene and letrozole can trigger ovulation. They can also stimulate the ovaries excessively. At this point, the ovaries overproduce hormone. It may result in symptoms including pelvic pain and bloating in the abdomen. Besides, in vitro fertilization or IVF also help patients who are trying to get pregnant. This treatment involves fertilizing egg outside of the body before returning it to the uterus. Although it can be costly, this may be the best method for getting pregnant when you have Pcos. For a patient who do not have plan to get pregnant, they can consume birth control pills that help to control menstrual cycle, lower androgen level, and reduce acne. Based on article review by Selma F. Wichel, anti-androgens such as spironolactone and flutamide can reduce growth of new terminal hairs. Thus, this can lower the androgen level in women that have Pcos. In addition, they can also consume diabetes medication. This is frequently used to reduce insulin resistance in Pcos. Additionally, it might help in lowering androgen level and reducing hair growth. For the excessive hair growth, patient can consume this medication with doctor prescription. For instance, depilatories. These are creams, gel, and lotion that break down the protein structure of hair so it falls out of the skin. And last but not least, they can consume hormonal birth control such as birth control pills and other contraceptives that use hormone to treat the unwanted hair growth and acne.
To summarize, the issue of Pcos among women is caused by 3 main factors, namely insulin resistance, obesity, and heredity. Fortunately, Pcos can still be treated through several treatments. The treatments can be categorized into 2, which is whether the mother wants to get pregnant or vice versa. Firstly, if the woman wants to get pregnant, she needs to change her diet into a healthy lifestyle to reduce weight. Then, they need to take medication to trigger and cause the ovulation, such as clomiphene. Next, the mother can do IVF treatment. Meanwhile, for women who choose not to get pregnant, they can consume birth control pills, diabetic medication, and medication for excessive hair growth.